Good afternoon, and welcome to this afternoon's session in honor of International Nurses Day. We welcome those who are joining us in person here at the Pan American Health Organization headquarters in Washington, D.C., and the more than 3,000 people who have registered for this online event from 83 countries in the world. Before we begin, we have just a few housekeeping tips. Number one, those of you who are here in the room, the screen in front of you, there is a tab there to turn on the microphone. Please do not touch it at all, because what happens is everyone on Zoom will hear it. So that's a do not touch. The next do not is this will be recorded. However, we don't have a Q&A, but those of us who are joining us virtually, you can greet and interact via chat. And also, please, if there are any technical difficulties, advise them through the chat. Simultaneous interpretation is available, English, Spanish, and Portuguese. And again, those of you who are in the room, if you look at the screen in front of you, there says front. The floor, I'm sorry, it says floor, and that allows you to use number 1 is Spanish, number 2 English, and number 4 is Portuguese. For those of you joining us virtually, as you can see on the screen, you'll find the globe icon, and just switch on that at the bottom of your screen. You can choose then the language of your choice, English, Spanish, and Portuguese. The goal of the International Nurses Day activities are really to foster spaces for dialogue, to exchange information, and to promote key actions to enhance nursing. Today's creating that space for information sharing. And the topic today is nursing in the Americas, evidence and strategies for a sustainable workforce. Today you're going to hear from speakers sharing their knowledge and experiences on the topic. You're going to hear from officials from ministries of health, academia, and professional associations. The International Council of Nurses, which, as you know, is a federation of more than 130 national nursing associations around the world. We're also going to hear from PAHO leadership, who will share PAHO's work in the area in support of PAHO's policy on the Health Workforce 2030, strengthening human resources for health to achieve resilient health systems. And then we'll conclude with the launching of a new virtual course, which happens today, on integrating simulation and technology in nursing and midwifery education. So of the many participants joining us today, I want to acknowledge just a few in particular. Number one, we are very pleased to offer a warm welcome to a familiar face to many of you, Dr. Silvia Cassani. I think all of you know Silvia is the former regional advisor for nursing and allied health personnel development at PAHO, and had that role from 2013 to last year, May of 2024, when she retired. So we applaud her many years of service in advocating for nurses and allied health professionals. Also, we have key leaders from PAHO who are joining us. Virtually, we are joined by Dr. Rhonda Seeley-Thomas, the Assistant Director of PAHO. And here in person by my side, we have Dr. James Fitzgerald, who is the Director of the Department of Health Systems and Services. And next to him, Dr. Benjamin Puertas, the Unit Chief of Human Resources for Health. Now, to officially open today's session, we have opening remarks from PAHO's Assistant Director, Dr. Rhonda Seeley-Thomas. Dr.
Thank you, Madam Chairperson, and good afternoon, everyone. Welcome to this celebration of International Nurses Day. And I'd like to thank you on behalf of the Pan American Health Organization, or PAHO, for joining us for this very important event. It is a privilege for the organization to bring together this group of outstanding panelists. Dr. Felipe Proenco, Secretary of Health, Workforce Management and Education from the Ministry of Health in Brazil, Dr. Sandra Moya, Director of Nursing, Secretariat of Health in Mexico, Dr. Sarah Swanston, Dean, Jean Hopkins School of Nursing, Dr. Vincent Guillermo Ramos, Executive Director, Institute for Policy Solutions, Johns Hopkins School of Nursing, Dr. Diana Mason, Program Director, Global Nursing Leadership Institute, International Council of Nurses. We come together to foster a discussion on the use of evidence and information in strategic actions to strengthen nursing, including the sharing of successful initiatives aimed at promoting a sustainable health workforce in the region of the Americas. The recently published PAHO report entitled The Health Workforce in the Americas, Regional Data and Indicators presents relevant findings on aspects related to the availability, distribution, and composition of the workforce. Our region has approximately 7.4 million nursing personnel, and they are the backbone of health systems, playing a key role in health promotion, disease prevention, and health management. For example, nursing and midwifery personnel can meet nearly 90% of the need for essential interventions in sexual, reproductive, maternal, newborn, and adolescent health, bringing safe and effective care within reach of more people. However, there are inequities in nurse availability, distribution, education capacity, working conditions, and in existing and projected future shortages of nurses. These inequities affect patient care and health outcomes, health system functioning, health equity and access, universal health coverage, and economic and social development. On International Nurses Day, PAHO seeks to foster spaces for dialogue and knowledge exchange, and to promote key actions to enhance nursing in the Americas in 4 areas: the use of evidence and information in the development and implementation of health policies, fostering the implementation of interprofessional health teams, increasing the attractiveness of the profession and the retention of nurses, and ensuring adequate working conditions. Yesterday, the World Health Organization launched the State of the World's Nursing 2025 report, which provides an extensive analysis of the global nursing workforce, identifying key trends, challenges, and policy priorities that are needed to achieve sustainable, equitable, and effective health systems that are based on primary health care. There are only 5 years remaining in the 2030 Agenda for Sustainable Development. In order to make further progress on the SDGs, or Sustainable Development Goals, and to build resilient health systems, it is essential to have an adequate number of health workers that are well distributed and with the necessary competencies to address the health needs of populations. The health workforce inequities must be urgently addressed. To advance in that direction, it is essential to mobilize sustainable, long-term, domestic and external investments in nursing to support the needed scale-up of nursing education and employment to offset such shortages, stem nurse, under and unemployment, improve working conditions, and manage health workforce migration, a growing problem in our region. Investing in education, employment, and leadership of nurses will stimulate economic growth and gender equality by creating decent jobs for nurses and greater economic participation by women in the workforce. Governments should also address key issues impacting the health of the health workforce. By investing in workforce protections, well-being, and mental health, and international collaboration, they can ensure resilient health systems that provide equitable and high-quality care. I hope that the discussions at this event motivate you to continue your efforts to strengthen the nursing workforce in the Americas. And let us carry forward the spirit of gratitude and admiration for the nurses who inspire us every day. Your compassion, skill, and relentless dedication make a difference, not just in the lives of your patients, but in the strength of our communities and in the heart of our healthcare systems. Thank you, and I wish you a successful webinar.
Thank you, Dr. Seeley, for the overview and listing some of the many challenges that the nursing workforce and the health workforce in general are facing. What we're going to do now is move on to the first panel that will be addressing some of these challenges and talking about the strategies and initiatives that they have used to strengthen nursing. And for that, we're going to be hearing from government officials from Mexico and Brazil. Brazil? Okay. So we're going to start with Brazil. Dr. Sandra Moya, Director of Nursing and Secretariat of Health. Mexico, excuse me. Okay. Dr. Sandra Moya, Director of Nursing and Secretariat of Health of Mexico, who is online? Is not online. Okay, then I misunderstood. She will be online shortly. We're going to start with we are starting with Brazil, but it's Dr. Felipe Rouanço, who is a Secretary of Health, Workforce Management and Education with the Ministry of Health in Brazil. And he'll be speaking with us right now.
Muito obrigado. Muito boa tarde a todas e a todos.
Good afternoon. Thank you very much. I greet colleagues from several countries who identify themselves here through the chat, and I'd like to also greet all the colleagues at PAHO who were named and who are at headquarters. I would like to start congratulating all the nurses for this very important day and the necessary celebration of this work, which is so basic and fundamental to all health systems in Brazil. It is a very important role that they play. We even call them the heart of the single Brazilian health system. Therefore, I intend to talk with you about some characteristics of the nurses' workforce in Brazil, some challenges that we have been discussing in terms of the role of nursing, and at the same time, some initiatives and perspectives, some actions that the Ministry of Health in Brazil is developing in this area. This is a public panel which is offered by the Health Ministry of Brazil with information about the workforce in health in our country. Here are the data for nursing. Over 1,378,000 nurses registered in our system, our information system for health services, of which they have two characteristics that call our attention. 70% of these workers are technicians of nursing. Almost 30% of these workers have tertiary level of education, college, university. The other thing is that most of them are women in Brazil. Over 85% of those linked to the health system are women. A little under 15% are men, as you can observe the distribution per age group. We're talking about nurses who are registered in our information system for the health services. When we look at general data, we have a good number of professionals that have trained in nursing. They are over 3,300,000 professionals in this area. with a predominance of technical training and then university level. 1,300,000 are registered in the health system, which corresponds to 1,600,000 ties, because they can be working in more than one place. So this gives you an idea of nursing in Brazil, and at the same time, from the point of view of family health teams and our model of primary health care is present in the over 5,500 municipalities of the country, and this corresponds to 53,000 family health teams that are composed by a nurse technician, besides a doctor and community agents. Within the country, we have a bigger number of workers in the Southeast region, which is the region with most inhabitants in Brazil. But this distribution of nurses reflects an inequity in the distribution of health workers in Brazil. The Southeast region is the one that has most people. It concentrates proportionately a larger number of professionals than other regions. The participation of nurse technicians and nurses is also reflected in other regions of the country. Most of these workers are directly tied to the public service, the single system. 62% of nurses, 50 of these, 15% work in private entities, and 22% NGO type or philanthropic entities within the single public system. You see here in green and yellow, they are directly hired by public services and beneficial services. The private services are part of our registry as well. We understand that this is a strategic look at nursing, and we congratulate all of the health workers and AHO for promoting this event. It is nurses that guarantee the right to health, because we understand that each and every one has a right to health. The state needs to provide quality service, respecting diversity in terms of care. And as Rhonda said, we have to think equity, gender, and the health ministry has a series of programs geared towards federal initiatives to value the work, because there is a difference in remuneration, men earning more than women, and we are working towards modifying this situation. We apply the single system known as SUS everywhere,
tem papel fundamental na
because
gestão
people who work at
das
SUS
secretárias de saúde dos municípios brasileiros.
have a special responsibility. Most of the state secretaries of health are nurses, and they understand how to manage health, and it is important to have this role to empower users,
pelo Sistema Único de Saúde.
making their autonomy easier and easier. We have challenges to expand nursing, especially among vulnerable and neglected populations. In some areas in Brazil, family health teams have not gone there, and this care is very important, and there has been investment from the federal point of view in terms of what we call a street office to integrate these populations within the system, and the expansion of oncology services in Brazil
participam de uma forma importante desse planejamento que realizamos.
This planning that is done in terms of the workforce guarantees a better distribution and better fixation of people in certain areas. And we pay a lot of attention to the quality of their training. We promote technical courses and specialization for those who have already been trained among nurses. In terms of work management, it is always a challenge to guarantee a safe working conditions, to improve the conditions and relations in work with our Congress.
Prontamente atendida pelo governo federal, que é o chamado piso da enfermagem, aonde o Ministério da Saúde repassa recursos
for a basic wage, and the federal government, when necessary, fills in the gap of what is mandated by law to pay for the nurses. We are always in contact with associations of nurses, with universities, to establish parameters for the teams. Regulation of the profession is a theme that comes up very often in Brazil, taking into consideration the different categories in the health system. When we think of SUS and the promotion of health and safety of the workers who work in remote areas, in the periphery of the big cities. The pandemic, which brought to the forefront the importance of nurses' work and mental health. Professional stability is also an issue that we are dealing with, and investment in the quality of life at work. Therefore, we understand the need for policies that respond to that. This is why the Ministry of Health within our SUS system that counts on the participation of 27 states that have their obligations within the system and the over 5,500 municipalities that have their own responsibilities in terms of primary health care and popular participation, social control. These are the main policies that the Ministry of Health takes into account and develops along with nursing, along with their associations, counting always on the exchange of international experiences and the documents and guidelines of the World Health Organization and PAHO as well. We just lost our speaker. Could somebody please call his attention to the fact that we can't hear him at this time? Please. And we see that his audio is...
As iniciativas das políticas públicas.
I was talking about public policies. It is important that along with PAHO, we are debating the advanced practices of nursing, be it from the point of view of task shifting, sharing,
onde, por exemplo,
tasks, in other words, primary care, nursing has a very important role in primary care, and we should continue along these lines. We have a working group where we talk about regulation and the implementation of these broadened functions in an environment that favor SUS. We are revising the careers in health, all the associations and entities that represent health professionals, which of course include nursing, and we are studying the careers at all government levels. We have a proposal for a national program that deals with the health of the health worker, which is something that stood out during the pandemic, and we have initiatives in this area. We have a national program, and we guide states and municipalities, and at the same time, we are finishing up norms to transfer resources for committees that deal with assisting health workers, and mainly nurses who will reap the benefits of this. And at the same time, mental health is one of our concerns when we manage their work along with all the processes of ongoing education. There's an important debate in Brazil now that includes regulation of the Ministry of Education, asking what could be the online training for nurses, and we also reaffirm that in order to train nurses, contact with people is fundamental for health services. And this is a topic which is very much alive in Brazil and will be regulated the next few weeks by the Ministry of Health.
And at the same time, we need to promote greater democratic participation. And that has been the perspective of our single healthcare system. It is a system that prioritizes social participation in promoting a stronger democracy in Brazil so that people may live better lives, so we may reach higher, better health indicators. And for that, we need to understand the social determinants of health in Brazil better and also continue to face the great inequities we see in Brazil. We have gone through a very difficult time, especially between 2016 and 2022. We saw an increase in the level of inequity in Brazil. Last week, we received a very important report, an assessment. We have once again reached the lowest levels of inequity that we had experienced in Brazil back in 2012, but still, we need to continue to lower those numbers. Nursing is a part of that process, but we also need more answers, and the Brazilian Ministry of Health is committed to find those answers. I thank you for this opportunity, for the invitation to participate in this event today, and I want to make it very clear that it's always an honor for us to speak about nurses, nursing professionals, and the Ministry of Health in Brazil is committed to be active in these dialogues and seek improvement through public policies. Thank you very much.
Thank you, Dr. Provençal, for sharing that and sharing the situation in Brazil and how the federal government is working closely with the states and the provinces to put forth these policies and programs. Now we're going to move to Mexico, who's online with us, Dr. Sandra Moya, who is the Director of Nursing, Secretary of Health of Mexico. Dr. Moya?
Hola, muy buenas tardes. Muchas gracias por esta gran oportunidad de poder hacer uso de la voz en tan importante evento. Agradezco a la Organización Panamericana de la Salud, pues, que esta oportunidad nos otorga en el día de hoy al país de México. Ustedes, siendo la agencia más antigua de salud internacional, fundada desde 1902, y que sigan empeñados en que esto puede ser diferente en políticas públicas, en políticas de salud. La verdad es que es algo de aplaudirse el que siempre se da continuidad a que las cosas pueden ser mejor en este país. Trabajamos muy fuerte, pero ustedes lo hacen no solamente para un país, sino que realmente están presentes en muchos otros. Y escuchar ahorita a quien me antecedió, a nuestro colega de Brasil, hablando de la importancia y esta gran problemática que se tiene respecto a lo que son las políticas públicas y políticas en salud, pues la verdad es que creo que eso nos hermana y nos solidariza para ir creando estrategias diferentes y ir creando esas posibilidades de redes de apoyo entre todas y todos para poder trabajar todos de forma más armoniosa y que podamos llegar a mayores lugares. Pues miren, la verdad es que voy a solicitar de favor que den acceso a uno de mis colegas para que pueda subir la presentación, pero sin lugar a dudas, mientras la suben, pues vamos a comenzar con esta importante oportunidad que nos están dando de poder ser escuchados. Un tema tan importante, lo que son las estrategias, iniciativas para fortalecer la enfermería como tal, es uno de los grandes retos que tenemos. Sin lugar a dudas, tendríamos que estar explorando cómo es el papel de la formación continua en la gestión del talento humano. Tenemos que analizar desde varios puntos la importancia de crear estrategias para poder hacer lo que es el personal de salud más fuerte. Y no solamente enfermería, sino a todos como un sistema de salud. Tendríamos que también reflexionar. Quien me antecede dice que pasan situaciones complicadas en su país. Estoy segura que no es el único. Reflexionar sobre esta oportunidad, sobre propuestas aplicables en entornos de alta presión, en donde los sistemas, pues con tantas enfermedades crónico-degenerativas, con enfermedades no solamente las crónicos, sino también las emergentes. Voy a pedir de favor que pasen la siguiente lámina. Muchas gracias. Y ahí lo que les hablaba respecto a estas propuestas de que realmente se pueden aplicar. Por favor, la siguiente. Sabemos que ahorita, la siguiente lámina, por favor. Tenemos entornos de alta presión, escenarios con elevada demanda, escasez de recursos, condiciones operativas complejas en cada uno de las áreas donde podemos estar. Implica que también nuestro personal de salud está pues con un estrés sostenido, también eso es algo muy sabido. Hay una carga laboral pues excesiva. Tenemos que trabajar en tomar decisiones rápidas y decisivas como Sistema Nacional de Salud y como países tenemos que hermanarnos para poder trabajar de forma colaborativa. Requerimos mucha resiliencia, requerimos más que nunca fortalecer el liderazgo de cada una de nosotras y nosotros. Tenemos que adaptarnos. Sin lugar a dudas, la única palabra que puede ser la constante es la incertidumbre, y pues todos los países y todo el mundo, sin lugar a dudas, vivimos en esta cuestión de incertidumbre. Entonces, teniendo en contexto que tenemos entornos de alta presión, pues voy a comentarles un poco cómo estamos en México, que no va a distar mucho de los países que estamos en este momento enlazados. Esa lámina, ahí nos habla de qué está pasando con nuestra población, y pues el personal de enfermería no estamos exentos a que estamos una población envejeciendo. Tenemos que estar viendo quién va a cubrir esas plazas. Ustedes ahí pueden ver esa lámina que la verdad en la línea superior están esas 18 entidades federativas. México, contamos con 32 entidades federativas, de las cuales 18 entidades federativas pues ya están en un momento muy complicado porque hay un mayor número de personal con edad avanzada. Tenemos que estar viendo que realmente en las escuelas, en esas universidades que nos representan, ahorita veía que ya muchas colegas mías de México, de importantes universidades están conectadas, y quiero comentarles que esa es la situación que estamos viviendo en México. Sin embargo, ya estamos trabajando de forma colaborativa con un órgano colegiado, que esa es una gran fortuna que tiene México, que por decreto se instaura lo que es la Comisión Permanente de Enfermería. Entonces, en esa Comisión Permanente de Enfermería estamos trabajando y sabemos que esa es nuestra situación actual en este país. Por favor, la siguiente. Sabemos que existen grandes retos. Por eso es que en esta comisión permanente están las universidades, están los hospitales privados, están las instituciones de salud, están los colegios.
We have healthcare institutions and colleges. We need to strengthen all these different areas where we are able to continue to work with the people. We need to improve communication, leadership, and teamwork, as well as the ability to respond. And this will lead us to reduce mistakes. And also, we need to emphasize leadership. We need to increase motivation so that we can talk about improving quality of healthcare. Also, we need to train people in critical areas. My colleague was talking about the enhanced roles of nursing, and it is important to strengthen primary health care as one of the most important places by which we can reach more and more people. We have the National Development Plan in Mexico, which has national policies aligned to territory and epidemiological needs. We also have our female president, in Mexico, and the National Development Plan has provided a set of policies for the next 6 years. The epidemiological environment and the current profile gives us the idea of what we will be doing and how we will be training our nurses. We have also policies for the sectoral health plan, which is underway, and there is an enhanced role for nursing, and it's one of the main needs for that plan. Also, training people in leadership, mental health, self-management, and primary health care management, and also the strengthening of the primary health care with a focus on the community. We are receiving training, education with a view to getting a bachelor's degree, and so a person who is being educated in nursing, you are also helping to influence a whole family. If you are able to train families and help families, this will have a way in which your work will be distributed throughout the community. There is also the kind of work that we are doing with our training is articulating with the different territorial divisions in our country. We also have programs that are adapted to different contexts, which are intercultural and community-based. So we have very many different intercultural contexts. So as nurses, we need to be respectful and understand people where they are in their context so that people allow us in and we are true allies. We have 32 states from Aguascalientes to Zacatecas. Each one is a different culture, a different environment. So we have a large territory, and therefore we need the active participation of all of us as nurses so that we're able to reach all those areas in our country. We need to understand that having the permanent nursing committee is very significant because this allows us to work in cooperation and be able to understand local needs, and we need to understand how to strengthen our skills whenever we are training ourselves and then working out in the community. Next slide, please. We are not a country that lives in isolation. You work with us. We are able to exchange, to get to know each other, and also to exchange proposals amongst ourselves, and this helps us carry our work forward. So we need to continue to strengthen collaboration with other countries. Investment in training in people, in human talent is a great strategic investment for health systems in general. We need to have more forums like this one, which help us to increase efficiency, strengthen equity, and contributing to better institutional resilience. Countries need to be able to feel synergy, that we are strengthened to continue to succeed. So institutions are important for that reason, and it is great to be able to focus on synergy. This is the only way in which we are going to be growing economically. When we talk about development and investment in health, we need to understand that there have been different kinds of investments so that the systems can be strengthened. So we needed to be able to provide quality healthcare, but also provide our nurses with stability. Countries face similar problems where nurses are looking for other places to work, and this is another one of the challenges that we have as a country. Next, please. So here we have some proposals for the Mexican context. For example, we have been working on different areas. I am the general coordinator of the permanent committee. We didn't start from scratch because we are following in the footsteps of so many who have already led the way, and we have national leaders who have created the basis for our work. And so we just continue to improve on the training content so that they can solve actual problems within the system. We want to enhance access to both virtual and in-person programs. We need to formally recognize participation in continuing training and to strengthen the competencies of leadership, mental health and collaborative work. And now to conclude, we need to understand that continuing education and training is key to be able to respond to the high pressure context that we're living not only in our country but worldwide. This training is not a complement, it's not complementary, but it is a strategy that is key to sustainability of the system. And promoting resilience is important to give quality of care or care which is high quality, and to continue to develop healthcare staff. We need to emphasize training and to care for those who are the caregivers. We are those who care for others. And when we talk about managing human talent in health, we're not only talking about administrative processes, but also how to take care, train, sustain those who work in the most demanding environments of the system. Throughout the crises that we have gone in the healthcare system, nurses are always on the front lines. Nurses every day show that they're always there with empathy. They're always there to take care of people throughout their life course. That's nurses. So today I'm very happy and I'm very thankful that I'm here representing my country to celebrate the International Nurses Day. And undoubtedly, see here on this slide a sentence that says that choice is individual, and choice may be individual, but it has collective effects for everyone. So we should never forget that. And these events help us to understand that knowledge has no borders. We can be in solidarity with other fellow nurses, and keeping in mind that we have principles of loyalty, working in collaboration, respect, and agreeing that our work is to continue to improve health in our countries. I would like to say as final words that Dr. Jose Moya and Dr. Liva Lopez have been here helping us, and we are continuing to work, and we have our agenda, and we have to continue to work together in collaboration. I am only one cog in this wheel. We all collaborate. Undoubtedly in Mexico, the permanent nursing committee will continue to work for training of excellent nurses. Thank you again for your attention, and happy International Nurses Day. Thank you all.
Thank you, Dr. Moya. And thank you for sharing what you're doing in Mexico and the impressive work with the National Development Plan. I want to thank both you and Dr. Ponzo for sharing the situations in Mexico and Brazil. We're about to move on to the panel. I do want to apologize briefly for there was a time where we did not have the English translation, and the council had stopped working, but it's working now, so there should be no problems in the future. So now we're going to move from the country perspective to look at the regional perspective. Our second panel is going to focus on the situation of nursing, evidence and strategies for a sustainable workforce. And the panel moderator for this is going to be Dr. Benjamin Puertas, who is the unit chief of the Human Resources for Health team here at PAHO, and that is, of course, the group that has coordinated today's session. Dr. Puertas?
Thank you very much. And, I would like to welcome the panelists for today, and we will be starting presenting the situation of nursing in the region of the Americas by Dr. Bruna Moreno. And also we have with us Diana Mason from the International Council of Nurses, and she will be presenting the strategic role of government chief nursing officers. And also we welcome very much the Johns Hopkins School of Nursing here present. We have the role of nursing in health policy strategy for a sustainable workforce by the Dean of the School of Nursing, Sarah Santon. And also from the Institute for Policy Solutions from the same university, we have with us Vincent Guillermo Ramos, and he will be presenting the nursing profession's role in ending unequal treatment in the U.S. implications for the Americas. So we'll begin with the first panelist, and that is the situation of nursing in the region of the Americas. So we welcome Dr. Bruna Moreno.
Gracias, Benjamin. Buenas tardes a todas, a todos. Perdão.
Good afternoon. It is a pleasure to participate in this International Nurses Day and share this space with the panelists and those who are here in this room, and tell you that this year is strategic for nursing. We have yesterday there was a launch of the report of the worldwide situation of nursing, and this was a launch done by the WHO, and so it is an important time for nurses. Now I'm going to talk about the situation of nurses in the region. We have the report of nursing in the region, in the world, but also we have a report specific for the Americas. In the region, we have 7.4 million health professionals focused on nursing, representing 63% of the healthcare personnel, and this includes all the healthcare profession. However, there are inequities in the availability of these professionals. 69% of these nursing professionals professionals are in high-income countries, and only 40% of all the population of the region is found in these countries. And also our differences in density. There are countries where we have 7 per 10,000, and there are others where we have different numbers. The density in some are less than 30 nursing professionals per every 10,000 inhabitants. So this range is important when we talk about inequities. I think it's important to remember that countries should have planning strategies for nursing staff, and planning should be done from the point of view of healthcare labor market, so that you can take into account need as well as supply and demand factors. Take a look at demographic information. Nursing is a young labor force. 59% of nurses are under 45 years of age. However, there is 19% of this labor force which is over 55. In other words, these professionals will be retiring in the coming years, and this distribution, this age distribution changes country to country. In some areas, those who are over 50 are 40% of the nursing labor force. In addition, nursing professionals are mostly women. 87% of nurses in the region are women. And we need to point out that women in the healthcare sector are facing inequalities regarding salary level, opportunities for leadership, as well as benefits. Another piece of information that is relevant is migration or brain drain. There is a complex dynamics of the labor market, and it influences both the countries of origin as well as the countries of destination. It affects those countries that already have fewer professionals, nursing professionals. There is brain drain, and there is transfer of the investment that has been already made for training nurses, and many of these nurses then leave and go to high-income countries. This phenomenon increases the scarcity of these professionals, which can be 1.6 million professionals for Latin America and the Caribbean. So as you can see on the map here, or on the chart here, North American countries have the largest proportion of nurses born or trained abroad. Regarding education, there are differences between countries or among countries in the ability to train new generations of professionals. These nurses that are trained have different levels of competencies, different levels of education from different nursing schools. And there is inequity in the distribution of nursing schools in the region. 86% of nursing schools are located in 2 countries, representing 50% of the population. And the access to opportunities of training and education are limited in the region. In addition, teacher training through doctoral programs is also limited for Latin America and the Caribbean. 65% of programs are located in one single country, and this limits the ability to have advancement for the teachers so that they have the necessary competencies to train future professionals.
Now, if we look at ongoing education, 57% of countries do offer ongoing education within their national HR plan. Something else that's worth mentioning is only 44% of countries have interprofessional educational standards. That is one of the strategies for innovating in education to achieve better health results through collaborative practices, working in interprofessional teams. Lastly, another important issue is that the number of nursing graduates has undergone a sharp drop from 81 between 2018 and 2023. There was a considerable drop in graduates. That means there is fewer people are attracted to this profession. Now, the advanced practices have been adopted by 64% of countries. That is, they have adopted advanced practices, enabling the development of new skills. Greater autonomy ensures that the population has greater access to properly trained advanced nurses who have received advanced training. The median for the region, the median salary is $1,100 a month, maxing out at nearly $6,000. Now, if we look at the working conditions, we're also concerned. The results are troubling because the working conditions have a direct effect on the quality of care given as well as retention of the labor force. There's a low number of countries in the region that actually have laws that offer protection in the workplace for nurses. Mental health and well-being programs are offered in 31% of the countries, and those mechanisms to prevent acts of aggression against professionals exist or have been adopted in 36% of the countries. So it's important for us to address the main factors that have bearing on hiring and the retention of these professionals to ensure that the profession continues to be attractive and that the services offered not be undermined by a shortage of nurses. As regards leadership, 86% of countries it was found have a chief nursing authority in the government, and that is important for setting policy in the decision-making process as well. Otherwise, perhaps the resources, the skills, the competencies, and the autonomy would not be there otherwise. So, the International Day of Nursing does seek to address this, focusing on the strategic role that chief nurses in government have. It's important that more countries have such a position so that the priority areas can receive the necessary attention in nursing, and so that the disciplinary or the interdisciplinaries can be properly staffed. This is an infogram that's available in the 3 languages that gives you an overview of where nursing stands in the region. By way of closing, I would like to underscore that investing in nursing makes it possible to change realities and to build societies that are more equitable and healthier. Together, we can strengthen nursing in the region of the Americas. I thank you for your attention and happy International Nurse Day. Thank you, Doctor.
Now we're going to continue with the strategic role of government chief nursing officers, and we invite Diana Mason from the International Council of Nurses to join us to give her presentation. So please welcome.
Thank you very much. I'm honored to be here and bring you greetings from the International Council of Nurses on this International Nurses Day. Thank you. I'm going to try to be very brief because I know we're a little bit over time, but I want to say a few words about the strategic role of government chief nurse officers. You have just heard some information about the position of nurses in the Pajó region, but also in Mexico and in Brazil.
And the role of the chief nurse can be instrumental in making progress on many of these issues. So in 2021, the World Health Assembly called for member states to establish senior leadership roles for nurses and midwives with authority and responsibility for managing these workforces and input into health decision-making. They called on member states to consider appointing government chief nurse and midwifery officers. So across the world, this is an expectation and a recommendation from the World Health Assembly. Now, the International Council of Nurses has noted that globally more countries are reporting having a government level chief nurse, but we know that many of them do not have full authority or the resources they need. That's globally. In our region, PAHO has noted that although 86% of countries in the Americas have chief nursing officers, the participation of nurses in the development and implementation of health policies is still limited. I want to highlight Dr. Moreno and Diaz and Dr. Puerta's paper, a commentary that they recently published that's really good on this. It's called The Strategic Role of Government Nursing and Midwifery Chiefs in Latin America and Caribbean. And I want to call out this statement. The lack of contributions from government chief nurse officers and midwifery officers to policies and the absence of women from policy-making processes undermine progress towards achieving the Sustainable Development Goals and universal health coverage. These chief nurse officers are essential to the country being able to promote the health of their people. This is a document that the World Health Organization published in 2015. I was hoping that we would have an update of this, but it's not yet ready. It's not there yet. We're not there yet. But there is a statement from this report that was quite troubling. Many of these chief nurse officers do not have close relationships with ministers for health, finance, and development partners or politicians, and are often not at the health executive decision-making table. That's very troubling. We want chief nurses who have not just the responsibility for workforce issues, but for being a participant in promoting the health of the population. And they need to be leaders and at these tables. I've put up here an article that I co-authored with some colleagues in 1996. It is still relevant today. We define nursing stages of political development and said the highest stage, the fourth stage, is when nurses and nursing are leading, not just on nursing issues, but on the most important issues related to health in our times. So I want to encourage us to think about, we need chief nurses for developing that nursing workforce, a workforce that can contribute to the programs and initiatives and services in countries, but also to bring nursing perspectives to decision-making tables and policy debates. Now, I'm not going to go through this slide. There are these 5 different models or types of positions for chief nurse officers in government. What we want is the executive model, the last one. This is where the country has a chief nurse with line authority over nursing and who also shapes health policy, and that's crucial. Dr. Moreno Diaz and Dr. Puertas have outlined why this role is so important. And I just want to highlight the first one of these, to ensure that health policies consider the experience and knowledge of nurses and midwives. And look at the last one, implement programs that improve the health of the population. When we talk about the nursing workforce, it's about promoting the health of the people in our countries. I also want to call to your attention last year's report from the International Council of Nurses for International Nurses Day. They spent a great deal of time looking at how do we make the business case for nursing in these countries. And this report is called The Economic Power of Care. It's really good. I just want to highlight a couple points. The report makes the case that nurses are drivers of economic growth in countries, and that we know from research that a 1% increase in nurse density, the ratio of nurses to population, correlates with an increase by 0.02% in life expectancy and a 2.4% growth in the gross domestic product of a country. So countries that really are using nurses and chief nurse officers in a good way are going to see higher life expectancies and better productivity, economic productivity of their countries. So I want to challenge each of you to think about this. What is the role? Do you have a chief nursing and midwifery officer? If so, what is their role, their scope, and their authority in your country? Now, the Global Nursing Leadership Institute that I direct for ICN for the 2024 cohort is working with Dr. Moreno on a survey of chief nurse officers in the PAHO region, looking at what do they say their role is, the scope, their authority, the competencies that they think they have or don't have. And so I think we'll have a fuller understanding of the status of chief nurse officers in the PAHO region when that report is out. And so we, hopefully, I'm sure that Dr. Moreno-Diaz will be putting this in the newsletter that PAHO sends out on nursing workforce, excuse me. And so once you know the status of your chief nurse officer role, assuming that it needs to be improved, what are the health and economic arguments for investing in nursing and having a chief nurse officer in an executive role in your country? Now, you may say to me, I'm not prepared to make an economic argument. I'm not an economist. Well, neither am I. But you can turn to your economists in your universities and in other sectors and ask them to work with you on taking that ICN document on the economic case for care and translating it into what is the economic argument for my country. And then third, who are the potential stakeholders who you want to engage in trying to strengthen the role of the chief nurse officer? And I don't just mean supporters. Who might oppose it? And then develop a strategic communications plan that looks at how do you frame and message this issue for all of these stakeholder audiences. So I think there's a challenge here. Let's strengthen these roles. It's going to improve the nursing workforce, and it will improve the health of nations. And finally, I just want to end with a plug. I have this forum, so I want you all to be aware of the Global Nursing Leadership Program, because we do not get enough applicants from the Latin American countries in particular. We usually get nurses from the Caribbean. We get too many from the United States and Canada. The Global Nursing Leadership Program is a policy leadership program for chief nurse officers and other senior nurse leaders, but we are starting to look at mid-career nurses, and particularly those who are concerned with the broader health and social issues of our day. The program is in English, and while you may not be fluent in English, you could brush up and be ready for this program in English. The applications for the 2026 cohort will be open in January. If you Google ICN and GNLI, you will find information on that program. And finally, I would just want to say, I hope that some of you are coming to Helsinki for ICN's Congress in a few weeks. And if I see you there, please say hello. I would love to meet you in person. Bruna, I'll turn it over to, or whoever, I'll turn it back over to Dr. Puertas. Thank you.
Thank you very much, Dr. Mason, for your presentation. And we continue with Johns Hopkins University, we have the pleasure to have not only the dean participating as a panelist, but also the director of the Institute for Policy Solutions from Johns Hopkins. So both will be sharing with us their insights on the nursing profession. We'll start with Dr. Sarah Sanson, the role of nursing in health policy. So welcome, and the panel is yours.
Thank you so much, and I'll start sharing my screen. It's a true pleasure to be with all of you, and thank you for inviting both me and Dr. Ramos to speak. So I'm talking today about policy, specifically our role, nursing's role in policy. And so you may think, well, it doesn't matter to me, or I can't do it, or I don't know it. Policy really just means the rules around you. They could be the rules at your hospital or at your clinic. They could be the rules in your community. And of course, they're also local, state, and national policy rules. But it really just means the structure, the resources, the priorities that we all have good standing to be able to advocate on. And as you know, we're the largest segment of the health workforce by far. We're usually, in most countries, you add up all of the doctors and pharmacists and social workers and physical therapists and everyone, nurses still are the largest. We also are great communicators because we are always communicating with patients, with people, with families, with communities. And so that makes us good translators from one idea to another. Think of the power you have with the people around you, and you can translate that to policymakers, and it's essential. And so our contributions, policy is not just for other people to do. We as nurses need to engage in policy advocacy. We witness firsthand the effects of policy. We can identify gaps. We have a deep understanding of prevention. There's no other part of the healthcare system that's as deep in terms of prevention for thousands at a time and as individuals. And we have practical strategies. We understand social determinants. We understand equity. We are that linchpin for being able we have the respect and trust of others, and we understand what's important. And as you know, at least in the United States, we're the most trusted profession of any, not just health professions. And I believe around the world, nurses are #1 or close to #1 every year. And so policymakers believe us, they trust us, and so does the public. And as you know, when nurses engage in policy, we can have huge effect. And you can see that in the examples on the slides in terms of nurse-led legislation, maternal health policy, the roles of CNOs in pandemic response planning, and shaping global policies via the collaborating centers and the ICN initiatives. I want to underscore this is not somebody else's job. This is all of our job. And one of the things that we're doing at Johns Hopkins is our beginning nursing students, the people who are becoming nurses, they can take a policy honors program where they're learning how to do elevator pitches, they're learning how to do power mapping, because we want everybody who graduates to understand how to see the power in any situation, where they work, a small business, Congress, wherever they are, to be able to see who's got the power, and in any situation they're trying to change, who could be their allies, how to keep people close, how to message. And so we see it as a strategic imperative and hope that other schools of nursing will do the same. As you know, there's barriers. Some of them are just in people's minds. Some of them are, Diana Mason was calling out some of this about our roles in advisory bodies and national councils. Educationally, we're trying to combat this by giving formal training in policy and systems thinking, but not every nursing school has that. And then several people have talked about how nursing is a gendered profession. And sometimes the aspect of that people think that women shouldn't be at a policymaking table. But there are a lot of strategies to strengthen our voice. I mentioned the Policy Honors Program. We also have training in strategic communication. We have a journalist in residence. There's a lot that you can do that doesn't cost much money. And students are very happy to be working on policy projects. And then if they work on a policy project with a faculty member, that faculty member is also getting the push to move what they're working on into the policy realm. Of course, other strategies are to elevate chief nurse officers within ministries of health, as Diana Mason was talking about, supporting nurse-led research and evidence translation for policymaking, and fostering interdisciplinary coalitions and alliances. I'll leave it at that. I know that we are tight for time, but I'm very thrilled to be here, and I thank you.
Thank you very much, Dr. Santon, and definitely the role of academics in training health policy leaders among nurses is a priority. So we pass the floor to Dr. Vincent Guillermo Ramos. So please, the panel is yours.
How's that? That's better. Good afternoon. I'm Vincent Guillermo Ramos. I'm the Executive Director of the Institute for Policy Solutions at Johns Hopkins University School of Nursing here in Washington, D.C. We're actually located at 555 Pennsylvania Avenue. I'm going to be talking about the nursing profession and our role in ending unequal treatment, or I'm going to call that our role in ending inequities. I'm going to use the United States as a case example, but what I'm going to share actually has implications for the Americas at large. So I won't spend a lot of time talking about the World Nursing Report. I think there was a really great presentation by Dra. Moreno, who actually went through some of the main findings. But what was interesting to me was the piece that spoke specifically about inequities and made the connection between the nursing workforce and the major threats to achieving global health goals. And I want to focus on that because too often we are talking about nursing, and that's something that I feel very proud of. I am a nurse. I'm a nurse practitioner. I specialize in public health and infectious diseases. However, when I think about my role as a nurse, while I'm deeply committed to my profession, actually my first and foremost alignment is with population health. Thinking about the big issues both within nursing and outside of nursing, that actually from a nursing perspective I can shape. So I want to spend some time talking about this concept of inequities. The report spoke to a number of things, very briefly: the distribution and availability of nurses, the differences in our educational achievements and opportunities to pursue more training and more education, the lack of opportunities in terms of professional development, leadership, the low adoption of advanced practice, and then high migration rates. I think all of those points were made very beautifully in the prior presentation. The little line that you see that goes below is that it really makes the case for how this affects the region's ability to achieve universal health coverage, in my words, population health, health security, health-related development goals. And if you look on the left, often we use this term of inequities, and I want to make sure that in this room I'm being very clear about what I mean by that. I mean the unfair and unjust ways in which care is structured and delivered, both in terms of policies and also in terms of practices. Really, really important. In the US, as an example, this is by no means an extensive review. There have been a number, anyone can open up their phone and see on their newsfeed similar kinds of issues. Measles jumps borders in North America with outbreaks in Canada, Mexico, and the US. What's happening with WHO if the US is to exit. PAHO report reveals that 14 countries in America face health worker shortages. We've got issues around funding for global health initiatives. We've got challenges in terms of NIH bans. And is USAID going away? Again, this is by no means an exhaustive list. These are just some of the things at any point you can look on the news feed. And from a nursing point of view, I have become, and I'm sure many of you and others that are listening have become very worried about what does this mean? What is our role? how should we be responding? So I want to say that there is an important case study in the US, and for many, many years, not just now, we've had inequities in our country. For a long time, we talked about them as being sort of negative differences, outcomes. And for a period of time, we talked about them as health disparities. But increasingly, we are specifically referring to them as health and healthcare inequities, unfair, unjust ways in which care is provided and also structured. There have been reports as early as 1985, and even before that, that showed that these inequities existed. I don't have time today to review all the reports, but I am going to zoom in on last year, the 2024 Ending Unequal Treatment Report that was released by the National Academy of Science, Engineering, and Medicine here in DC. It's a nonpartisan organization that focuses on evidence, not on any of the sort of political context that we may be facing. And so the task of this committee, I happen to have been asked a nurse and member of the committee that drafted the report. We were asked to examine the major drivers of healthcare and health inequities in the U.S. to look at successful and unsuccessful programmatic and policy interventions, to consider ways that we can scale those things that have worked, and also what kinds of things do we need to do in areas where we've not made progress, and ultimately to make a set of focused recommendations with clear actors and actions where we as a nation could eliminate health and healthcare inequities. At the end of our process, we worked for 13 months. We have 8 overarching conclusions, we have 5 goals, and 17 specific actions and actors in terms of things that can be done to eliminate inequities in the US. And so I won't have time to go through all of this, but I do want to invite folks to download the report. The QR code is in my slides. I'm also happy to send this to folks who reach out to me directly. The report is just under 400 pages. It's sort of a read full, if that's appropriate use of English, but there's a smaller version of 3 or 4 pages that gets to the main points. I do want to spend some time highlighting what I see as being some of the main recommendations from the report. And I think much of what we found in our report last year resonated with me when I was feverishly reading the World Nursing Report. I only had a day between yesterday and today. And so looking at the recommendations and making sense of the two. The first is that the United States has made limited progress overall in the elimination of health and healthcare inequities. And I would say that there has been some progress in Latin America and in the Americas writ large, but in general, there has been limited progress across the entire region. The health and healthcare inequities are concentrated in certain groups. In the U.S., it's racial and ethnic minoritized groups. Across the Americas, in minoritized and marginalized groups. We know that healthcare is part of a broader health system, and that health needs to be the sort of venue for where nursing is operating, not solely within healthcare, but both within healthcare and also in the broader health space. This is really important. There is a myth, the data in our report lays this out very clearly, of what some have called the zero-sum game. That somehow if one group benefits from a particular program or policy, that it means another group must lose. Well, the data suggests the opposite. The data suggests that when we lean in, and we actually address those who are most likely to have the inequity, where the inequity is found sort of most commonly, that does in fact benefit those groups, but it also benefits many, many others that are not part of those groups. I think the same logic could be sort of framed in terms of how we think about our nation, the United States, in relation to the Americas. This idea that we are a region, and forgive me for saying this at Tahoe, but I feel that more and more, we need to be making those connections around why what's good for one part of our region is good for other parts of our region. And when we do things that are harmful, that those things, yes, they definitely impact the groups that are mostly directly affected, but they also impact all of us. We are a system in the United States that is too heavily focused on diagnosis, treatment, and management of disease. We need to focus much more heavily on the integration of clinical and social care and prevention, health promotion, and wellness. And we also need to move away from the volume of services that are often tied to reimbursement and often generate sort of the costliest procedures. We've got to free up our workforce. Even in the United States, our workforce is too narrowly defined. We need new roles. We need to recognize all the team members, and we need to remove arbitrary restrictions on limitations that are not reflective of education, of scope of practice, and of competencies. We must ensure that we have a representative workforce. That means that the workforce must be in alignment with the communities that are being served. It cannot be that our workforce is disconnected from the people that are being served. We've got to address, as I've mentioned, social determinants of health and social care, meaningfully engage communities in ways that are elevated to equal status. We've got to be clear that we are collecting data on those equities and that we are able to use them as a way of quantifying where we go and where we target our efforts. And we need to stop simply describing the problems. And this would be the thing that I would want to emphasize the most. Stop describing the problems and start really identifying what those solutions are and how do we move forward in ways that we can scale those solutions. I want to end with a point that I've already made. I'll revisit it. There is this myth of a zero-sum game. This means that in the U.S. and across the Americas, there are societal divides and political polarization. This hurts all of us, and that effective collaboration is good for all of us, even when we think that somehow, this myth of zero-sum game is true when in fact it is not. I'm going to invite you all to an event that we're doing at the Institute for Policy Solutions. I realize that there are roughly 3,000 people that are registered at the event. It is online, it's free, and it's also for people that are here in DC in person and free. We're going to be looking at the sort of social and clinical care and the return on investment. There is a big push right now in the U.S. to eliminate many of the social care programs, and we want to debate that in a panel on May 22nd. Please check us out. Everyone's invited. I think it'll be useful not only for the U.S., but beyond that. And then lastly, my contact information, and if you want to learn more about the Institute for Policy Solutions, you can follow us online. The QR code will take you to our webpage where you can sign up. And remember, our primary focus as nurses at IPS Institute is to eliminate health inequities. Muchísimas gracias y fue un placer para tener un poco de tiempo con ustedes. Gracias.
Thank you very much. Before we pass on, I want to welcome our Deputy Director, Ms. Lu Valdez, who is with us. Thank you very much for joining us. And also I want to acknowledge the almost 900 virtual participants who have joined us, are together and listening to our discussions in the 4 languages. So welcome to you and thank you for being us. Before I pass to our next agenda item, I really want to comment on the differences and the elements that have been touched during this panel. I'm going to do it in Spanish for all. Hemos partido desde
We started looking at analysis of data recently. This was just launched a few days ago, but the analysis is something that our unit has been doing for a long time now, and we have been following closely the data on our region. This was followed up with a vision regarding the unit chiefs, despite the fact that 86% of the countries have chief nurses. That doesn't mean that necessarily hold any type of position of power, such as enabling them to make changes. And we held a host of discussions about what the academic component is of training leaders, how leadership and nursing needs to start in the classroom. You can't expect this to emerge on its own later because a leader is forged in the classroom. This is a very important aspect that our Canadian guest from Johns Hopkins told us about. Now, the key focus, pillar of our work, and what needs to happen to strengthen the health labor forces to fight against inequities. That's something that the Pan American Health Organization takes very seriously. It is a core part of the work that this organization does. And so the work of the Institute also focuses on this. This was already touched on. There are challenges, huge challenges regarding what we see in the region. There hasn't been much progress made in closing these gaps of equality, and together with the Pan American Health Organization, we continue forging ahead toward this goal. We're running out of time. I would thank all of the panelists, and I give the floor to Karen to move to the next item on our agenda.
Gracias, Dr. Puertas.
Thank you, Dr. Puertas.
Presentations. Thank you very much. I think one takeaway or many takeaways, but one line that I will remember, Dr. Santon's comment about policy, we always think it's somebody else's job. It's not somebody else's job, it's all our jobs. Right now, we will go to a very concrete launching of an activity on a product that PAHO has put together, the Human Resources for Health team. I'm going to ask Johanna Diaz to come forward. She's our advisor on professional education and human resources for health. She is going to present this virtual course that is going to be launched now. So you can enroll right afterwards.
Thank you very much, Karen. Good afternoon. I have the great pleasure to present to you the virtual course integrating simulation and technology in nursing and midwifery education that we are launching today. As you know, new technologies have transformed nursing and midwifery education in recent years, revealing new opportunities and challenges for educators and students. Capacity building for nursing and midwifery faculty and tutors is an opportunity to accelerate and expand training and continuing education strategies for these professionals to increase the supply and adequate distribution of qualified personnel and professionals who can contribute to achieving resilient health systems. So this self-learning course is structured into 7 modules. Participants are expected to dedicate approximately 24 hours of time committed and will have the flexibility to progress in their own pace. Making it ideal for any professional. So this course combines theoretical knowledge and with practical applications to provide a comprehensive understanding of the use of technologies and clinical simulation and their integration into nursing and midwifery education. So the development of this course was achieved thanks to the joint work of the Pan American Health Organization and experts from the University of Alabama, at Birmingham School of Nursing, PAHO and WHO Collaborating Center for International Nursing, and the University of Miami School of Nursing and Health Studies, whom I wish to thank and acknowledge for this important contribution. I would like to welcome also the presence of the elected director, Susan Walsh, Dr. Susan Walsh, President-elect of the Pan American Nursing and Midwifery Collaborative Center, that is here today with us. As you know, it's very important ally for our work. Thank you, Dr. Walsh. This course aims to equip participants with essential knowledge and skills in utilizing simulation and technology to enhance nursing and midwifery education. So upon successful completion, participants will receive an electronic and printable certificate from the Pan American Health Organization Virtual Campus for Public Health. So let me invite all of you to review the content and participate in this excellent opportunity to learn a little more. You can do so directly using the QR code that appears on the screen. And I also want to invite you to review the extensive educational offer available to the PAHO Virtual Campus platform. Thank you very much.
Thank you, Dr. Diaz, and all of you. The link is in, for those of you who are virtual, the link, of course, is in the chat. And now we're going to close. I want to say thank you again to all of you for being here today. and happy International Nurses Day. We're going to close with closing comments from the Director of Health Services Department, Health Services Systems and Services Department, James Fitzgerald, is going to conclude the session.
Yeah, thank you. Thank you so much, Karen, and a real heartfelt thanks to our countries, our member states that have participated here today, our partners, our collaboration centers, all the panelists, and most of all the 900 nurses from all walks of the profession that have joined us for this event. I'm going to let you into a little secret. We have tens and tens of global health events every year, international recognized events. I have to say International Nursing Day is probably my personal favorite day because I've never seen a group of professional health workers that are so committed and so mobilized to the cause of public health, health for all as nurses. So it's really a pleasure to have this opportunity to once again be with you and to be here today to close this event. We've really had a wonderful event, I think, in terms of looking at the data. If we do now, on a more serious note, begin to look at some of the data, it is a little bit concerning, and we will be working with our member states on addressing some of these issues. I really want to call to attention the call that the director made yesterday, a significant reduction of nursing graduates from 83 per 10,000 to 24 per 10,000 over a period of 6 years. Now, there's probably the COVID-19 factor that is in there, but we really need to look at that because between issues of migration, internal, towards upper income countries, that combined with reduced recruitment, education, retention, is going to mean that we're facing an important challenge moving forward. So just a little reminder of that call to action. But in closing, I really want to thank everyone in terms of your guidance, your insight on policies, on regulatory issues that we've heard, on the importance of community engagement, on leadership of nursing within all branches of government. And it's through that perhaps we can begin to really address some of the more complex issues as to why we face some of these really important challenges of recruitment and retention, and how we can really improve interprofessional care with nursing at the forefront, ensuring much better health and care for all. A special note of thanks to Benjamin and his team, to Karen, to Luna, to Johanna, and to all the team within the department for organising this event. And so with that, I really want to close this event and wish you a wonderful year, remaining committed to the cause, and we'll see you again this time next year for another International Nurses Day. Thank you very much.